Hello, this is Bill Morgan, president of Parker University, and today we have with us our very special guest, Dr. Alan Goldhamer, who's a researcher, an advocate, an author, but most importantly, he's a chiropractor. And Dr. Goldhamer runs the largest inpatient chiropractic-run clinic in the world. And we're just blessed to have you here today. And could you just tell us a few things about yourself, Alan?
Well, I'm glad to be here. The TrueNorth Health Center is a chiropractic facility whose focus is based on the premise that health results from healthful living. So what we're about is trying to teach people how to live healthy so the body can do what it does best, and that's heal itself. And we do that primarily by identifying accurately what the condition is that's limiting a patient's progress, and then providing them the requirements of health. The thing that we do that's kind of unusual is long-term medically supervised water-only fasting. We'll have patients undergo fasting from anywhere from 5 to 40 days on water only. And it turns out that many of the conditions that people are suffering from nowadays, things like high blood pressure and diabetes, autoimmune diseases, conditions like lymphoma, are caused or aggravated by dietary excess, eating too much animal foods or too much highly processed foods with added sugar, oil, and salt. So it's not surprising that when you put a person on a fast, the body's given the ability to reverse the consequence of dietary excess, go through a detoxification process, and normalize the condition. So things like high blood pressure will become normal, and eliminating the need for medication. And then if you're able to convince people to maintain a health-promoting diet and lifestyle, they can sustain the results. And we've been doing research on that effect and been able to demonstrate the largest effect sizes that have been shown in treating high blood pressure in humans. We took 174 consecutive patients in one study. 174 people were able to lower their pressure enough to eliminate the need for medication. And for people willing to do dangerous and radical things like eat good and exercise and get enough sleep, they can sustain those results.
So why chiropractic?
Well, fundamental to the chiropractic profession has been this idea of the body as a self-healing, self-regulating mechanism. And chiropractors traditionally have always been trying to remove the things that impede health from happening. And some of those things may be musculoskeletal or mechanical in nature. Some of them may be chemical in nature. Some of them may involve psychology. Different aspects of stress can interfere with the body's ability to heal itself. As a chiropractor, we try to address all of those things. So we want to make sure people are eating healthy, using their bodies properly, dealing with any problems that arise as a consequence of whether it's joint dysfunction or inappropriate movement or neurological function. And one of the most important things that we know we can do is make sure we put the right fuel into the body. And so a healthy diet, a healthy lifestyle are critical to give the body ability to heal itself. And that's exactly what we do at TrueNorth Health. The difference is we're in an environment where we can control the environment of the patient. So it's not just lip service. We're actually able to ensure that the person is getting rest, that they are going through the educational processes necessary to correct their bad habits. And if necessary, they can go through medically supervised water-only fasting so the body can rapidly reverse the consequences of years of dietary abuse.
So chiropractors have a difficulty in their scope of practice removing people from medications. So tell us about how your clinic would help me. If there's a patient came to me with a bucket of meds they're on, and we want to get them off those meds, but in my state of where I'm practicing, I cannot remove those drugs take the drugs from them.
One of the strengths of chiropractic is that we've been a drugless profession. We've recognized the dangers associated with trying to manipulate things from an external, exogenous viewpoint. But one of the weaknesses of the chiropractic profession today is even though we might recognize that drugs are toxic, we don't have the legal scope to appropriately withdraw those medications. And as a consequence, we are an integrative medical facility. So although we're a chiropractic philosophy-driven and a chiropractor-run facility, we happen to have 5 full-time medical doctors that work in conjunction with us. And those doctors' responsibilities is to do the initial medical assessment and come up with a plan to withdraw the medications from patients so that we can give the body a chance to heal itself. And so by working with medical doctors whose expertise are the prescription or the withdrawal of medication, we're able to overcome the limitations of scope of practice related to medication issues.
Now, earlier you and I were talking. We talked about the philosophy of chiropractic. It's our job to remove barriers to good health. And you also said that D.D. Palmer would really appreciate this. How does fasting gel with the philosophy of chiropractic? And maybe what would D.D. say about what you're doing at your clinic?
Oh, I think that if you look back at traditions of chiropractic, I think these types of interventions have always been important to chiropractors. The idea that by aggressively regulating diet, you can profoundly affect health, I don't think is anything new. In my training, even over 3 decades ago in chiropractic college, this use of nutrition and fasting was an important part of our foundation education. As far as our experience right now, particularly today, unlike, for example, when Dee Dee was practicing, we have an epidemic of obesity and diseases of dietary excess. So right now, if a patient does not have high blood pressure by the time they reach 65, if they reach 65, they're abnormal. Because the majority of people, the average or normal people, are hypertensive. Now, you don't want to be normal, you want to be healthy. And healthy people are not overweight, they're not hypertensive, and they're not diabetic. And yet we have an epidemic of diabetes amongst our children right now. And a lot of this is because of diet and lifestyle choices that are inappropriate. And so an important responsibility of the chiropractor is not only to correct any subluxations that may be present, but also to give the diet and lifestyle advice that's necessary so those patients can sustain long-term health. And that's what we're trying to do at TrueNorth Health, is not only show what, how to do it, but, what the broad range of conditions that respond to this traditional chiropractic advice. It's not just back pain and headache that respond to chiropractic care. It's also diabetes, hypertension, autoimmune diseases like rheumatoid arthritis and ulcerative colitis and ankylosing spondylitis and psoriasis and chronic cephalgia, and even some conditions like lymphoma respond well to these diet, sleep, exercise, and fasting type of interventions that chiropractors are known for.
It's true. And cancer is fed by sugar. So tell me about, you've had some interesting cases where you've treated cancer with this.
Well, we recently published a paper in the British Medical Journal. This particular patient had follicular lymphoma, stage 3. She'd been well documented and tracked for a couple of years. Even though her oncologist wasn't particularly enthusiastic, she underwent 21 days of water-only fasting at the TrueNorth Health Center, during which time her tumors disappeared. She fed for 10 days, went back to the medical school for follow-up. We've tracked that patient for 2 years, including post-CT. She's now cancer-free and continues to do well. Now, not everybody's going to respond as quickly or as consistently, in part because this is a patient that was very compliant. She was willing to do the diet and lifestyle changes and to sustain the diet and lifestyle changes. Because in my model, you're not curing anything. You're not curing lymphoma. You're not curing obesity. You can't cure hypertension or diabetes. What you can do is manage it. And if you manage it well, you can keep it contained and controlled so that it doesn't pose a limiting factor to the patient. But if they go back to the greasy, fatty, slimy, processed food diets that caused the problem, it's likely they're going to recur. So one thing we have to do is give up the medical model of cure and start thinking about management. What can you do to get the body in balance enough so that the body can kind of maintain a higher degree of health? And that's where chiropractic becomes so critical, because it's not just the musculoskeletal components, but also the full spectrum of our scope that's necessary to implement if we want to overcome particularly people that have been debilitated by these very serious illnesses. If your only problem is back pain, you may need nothing more than some mechanical intervention. But if you have a systemic illness, you have to approach it systemically. So that'll include chiropractic manipulative therapy, but also all of the other modalities.
So we were talking earlier about conditions. What conditions would you tell someone that you treat?
I really don't treat any conditions per se. I treat patients. We try to get people healthy. It happens to be that some of these conditions that are commonly thought of as primary diseases happen to reverse themselves. Like whether the person is overweight, have cardiovascular or blood sugar related problems, it's not really the blood sugar problems per se that you're treating. It's the fact that you have an unhealthy person in front of you. And some of the symptoms that are manifesting as a part of being unhealthy may be joint pain, or they may be headaches, or they may be high blood sugar levels, or they may be high lipid levels. But the mistake that's made, I believe, in my opinion, medically, is they're so busy trying to treat the symptoms of the disease, the high cholesterol with statin medications or the joint pain with pain medications, that they forget that you have to actually treat the underlying health of the individual if your long-term goal is to be successful. In medicine, they are free to admit, if you have high blood pressure, for example, or diabetes or any of these conditions, that if you do what you're told and you follow instructions exactly, you'll never get well. You'll be sick for the rest of your life. You'll be on medications forever. That's the promise of medicine, that you'll be sick forever. The chiropractic approach is a little different, because we're saying, look, we're not going to treat your specific disease process per se, but we're going to get you healthy. And if we get you healthy through diet and lifestyle change, through healthful living, there's a very good chance that these imbalances that were created by your poor decisions are going to correct themselves. It may not work for everything. There may be conditions, for example, that won't be responsive to diet and lifestyle change. I don't see very many of those in practice, but I'm sure that they exist.
Well, it's odd when you watch these commercials that the drug companies put out there, and they'll say things like, when diet and exercise don't work, use this statin. The thing is, diet and exercise always work. They always work. We just don't implement them to the degree they need to be.
Well, they never work when they're not applied. And if you don't, try, I think that's more lip service. Like, for example, do we really think that people's cholesterol levels, for example, are not going to come down if they make improved diet and lifestyle choices? But do people actually get a chance to implement those? I can tell you from my experience, not at all. Most patients are diagnosed of having high blood pressure. They're immediately put on medications. There's no concerted or concentrated effort to help them actually understand what's going to have to be done in order to get them well.
So when somebody comes to the TrueNorth Health Center, they don't just sit in a room and drink water all day. What else? What else can they expect? They go there, they show up, and it seems extreme, but this is from going up to 40 days. By the way, 40 days, that sounds kind of biblical to me. How did you pick 40 as being your maximum?
Well, Moses, David, Elijah, and Jesus fasted for 40 days. And actually, in our experience, you can go up to about 40 days without getting into too many complications. You can go longer than that. We have on rare occasion. But the problem is I don't like going longer than 40 days because of sleep deprivation. My sleep deprivation. I worry too much about it. So we try to keep it relatively what we consider contained. Up to 40 days, you can easily do that for patients without running into complications. We've published a safety study that shows it can be done safely and effectively using this protocol. But remember, this is done on an inpatient basis. They're seen twice a day by our staff doctors. They're monitored carefully with both blood and urine testing. They've had an initial and exit exam with a physician to deal with their medication issues. So this is not something that we would recommend patients do while they're working or running around or maintaining normal activity. They're in a controlled and contained setting to do this intervention.
And you're pretty successful with getting people off medications?
We're very successful with getting people off medications because most of the medications that we're trying to get people off of, they're on because of poor diet and lifestyle choices. So people that have high blood pressure, people that have diabetes, these are conditions that if you correct the underlying condition, the need for the medication is eliminated. And so it's possible to safely wean those patients off medications. And then if they're willing to sustain the diet and lifestyle changes, there's no need to go back on medications.
That's incredible.
So what we're talking about is really just getting rid of the underlying reasons why the medications are being prescribed in the first place.
And we're talking, when you get on these lifelong medications, metformin, insulin, you've given up. Medicine's failed. This is what you're going to have the rest of your life.
Well, they're trying to manage the effects of a poor diet and lifestyle choices without actually having to do the radical intervention like eating better.
Yes.
And of course, that's the nature of our society right now. Is people are looking for that short-term quick fix. We call it the pleasure trap. In fact, the title of our book's called "The Pleasure Trap: Mastering the Hidden Forces of Mind, Health, and Happiness." And it's basically the idea is that people are overweight and developing these diseases of dietary excess because we're putting chemicals in our food that cause us to overeat, and those chemicals include oil, salt, and sugar. These are not natural substances in concentrated form. We add these to highly processed foods, people systematically overeat, and they develop these diseases of dietary excess. All we're doing with fasting is undoing the consequences of excess rapidly. You can do much the same changes slower with just a careful diet and exercise program, which is exactly what we want people to do. However, it's hard for people to do that because they're addicts. They're addicted to the artificial stimulation of dopamine in their brain by these chemicals, just like drug addicts are addicted to it. So withdrawal can be a difficult process. With fasting, we can make that withdrawal process, whether it's drugs or the chemicals in food, happen more rapidly. And then people can, get back on track and develop the lifestyle changes with intense education and get healthy.
It's got to be frustrating when you look at the world where they look at fasting as being radical, but giving yourself a daily injection or taking a handful of pills every day is normal.
Oh, I believe fasting is radical because radical comes from the word radicus, which means root or cause. And so it's coming from the concept of dealing with the root or cause of the problem. So that for chiropractic is radical too. Diet and lifestyle intervention is radical because we're all trying to get to the root or cause of the underlying pain or problem.
So say that again. The word radicus?
I think radical, I believe, derives from the word radicus, which I believe it has to do with root or cause.
That's fantastic. Now, as we complete our interview today, is there anything else you'd like to share with our audience?
I just want to share my strong belief that health results from healthful living. Let's not forget it's healthful living that's the root intervention that's necessary if you're trying to overcome health problems.
Well, Alan, thank you so much for visiting us today, and thank you all for joining us today.